and welcome back to my channel. If you're new here, drop a note in the comments. I would love to say hello. I'm Colleen. I am a family nurse practitioner and an owner-operator of Serene Primary Care, a direct patient care clinic in Bellevue, Washington. The other thing we do is share health information, especially about women's health in their midlife and beyond. So today's topic, we're actually going to be talking about premenstrual depression in the perimenopausal time frame or the menopause transition. So we've talked before about the menopause transition is any time starting in our late 30s through our 40s until we are finished menstruating, typically in our early 50s. So one benefit of today's environment around women's health is that we are getting a lot more information coming out. There is great options for treatment. One area that sometimes isn't talked about is our mental health as we go through our menopause transition. I personally have seen a number of women end up hospitalized because of mental health breakdowns during their perimenopausal transition. I don't know exactly what this is related to. I'm suspicious that if you had postpartum depression or postpartum psychosis, that you're at greater risk for either increasing depression or increasing anxiety during your menopause transition years. That's something to just keep in mind for yourself, but also for your friends, because it's easy to be blown off or to feel like you're going crazy when your emotions start to kind of take over and make decisions for you. So there are treatment options for the menopause transition period. Sometimes it requires hormones like estrogen and progesterone. Sometimes it might require a little bit of testosterone. We also want to make sure we're checking in on your thyroid, checking in for anemia, making sure we're not having any other underlying health condition that could be causing the mental health symptoms. Now, hormones aren't always an option for some women, and they're not always what is preferred. Women have a lot of different choices and opinions about their bodies, and every woman should be given the correct information in order to make the best decision for herself. So the other options might include a medication like venlafaxine, which is also known as Effexor. We know that we can use paroxetine. Am I saying that right? Oh my goodness. And you can typically use that only during certain times of your menstrual cycle if you're still cycling. So some women like that they don't have to take a pill every day. I've also worked with some women to use kind of rescue medications. That might be something like buspirone, or otherwise known as Buspar, propranolol, which is a beta blocker, which some women really like because our heart palpitations, if you're prone to heart palpitations, they seem to increase when we're fluctuating with our estrogen. So the propranolol can just kind of stop those palpitations, which eases the anxiety related to that. So basically, take-home message today is mental health and the impact on your mental health during your menopause transition years is significant, and to be especially aware if you or a friend had any mental health crises surrounding pregnancy or maybe even puberty. Again, this is another time of hormone shifting, and when that happens, it does impact our brains. So checking in, making sure you're getting support. If you have questions, don't hesitate to reach out. My website is posted below. There's also, what else am I going to put in there? Oh my goodness. My website. Oh, but you can also leave a comment. So if you feel like just leaving a comment, I do try to respond to those as well. I hope this gives you some information and empowers you to feel like you can talk to somebody if you need to, related to your mental health during your menopause transition years.